prescribed azithromycin, Zithromax. Before you take your first dose, discover what it really does, how to take it safely, and the side effects you must watch for. Stay informed in under 60 seconds. Azithromycin, Zithromax uses, dosage, and side effects, everything you need to know. What is azithromycin, Zithromax? Azithromycin, commonly known by its brand name Zithromax, is a widely prescribed macrolide antibiotic used to treat a variety of bacterial infections in both adults and children. It is effective against infections such as strep throat, sinusitis, bronchitis, and pneumonia. This medication is typically taken orally once a day. Depending on the severity and type of infection, treatment usually lasts between 3 to 5 days. For added convenience, azithromycin is often dispensed in a prepackaged format known as a Z-Pack. What is azithromycin, Zithromax? Used for: azithromycin is prescribed to treat specific types of bacterial infections, with indications varying slightly between adults and children. In adults, azithromycin, Zithromax, is commonly used to treat acute exacerbations of chronic obstructive pulmonary disease, COPD, caused by bacterial infection, acute bacterial bronchitis, acute bacterial sinusitis, community-acquired pneumonia, streptococcal pharyngitis, strep throat, tonsillitis, mild to moderate skin and soft tissue infections, e.g. cellulitis, urethritis and cervicitis caused by susceptible organisms, genital ulcer disease, chancroid. In children, azithromycin, Zithromax, is approved for the treatment of acute otitis media, middle ear infections, in children aged 6 months and older, community-acquired pneumonia in children aged 6 months and older, strep throat in children aged 2 years and older, tonsillitis in children aged 2 years and older. How does azithromycin, Zithromax, work? Azithromycin belongs to the macrolide class of antibiotics. It works by inhibiting bacterial protein synthesis, thereby preventing the bacteria from growing, multiplying, or surviving. This mechanism of action makes azithromycin an effective treatment for a broad spectrum of respiratory, skin, and soft tissue infections. Azithromycin, Zithromax dosage forms, and typical dosing guidelines. Available dosage forms of azithromycin, Zithromax. Azithromycin, Zithromax, is available in several convenient dosage forms to suit both adult and pediatric patients. 1 tablets, 250 milligrams. Pack of 6 tablets available for as low as $9.38, about $1.56 per tablet. 500 milligrams. Pack of 5 tablets for $7.25, approximately $1.45 per tablet. 600 milligrams. Pack of 8 tablets priced at $18, $2.25 per tablet. 2 Z-Pack. A popular pre-packaged regimen containing 6 tablets of 250 milligrams. Cost $9.38, significantly reduced from the average retail price of $26.10. 3 Tri-Pack. Contains 3 tablets of 500 milligrams. Priced at $8.21 per package. 4 Oral suspension liquid form. Ideal for children or individuals who have difficulty swallowing tablets. 100 milligrams per 5 milliliters. 15 milliliters bottle. $13.66. 200 milligrams per 5 milliliters. 15 milliliters bottle. $13.66. 200 milligrams per 5 milliliters. 22.5 milliliters bottle. $16.99. 200 milligrams per 5 milliliters. 30 milliliters bottle. $19.66. 5 oral packet. 1 gram single-use packet. $15.92. Typical azithromycin, Zithromax. Dosing. Dosing may vary depending on the specific condition being treated. The dosage is generally consistent between tablet and suspension forms. For adults, pneumonia, COPD exacerbations, strep throat, tonsillitis, skin infections, 500 milligrams on day 1, followed by 250 milligrams once daily on days 2 through 5. Sinus infections and certain COPD infections, 500 milligrams once daily for 3 consecutive days. chancroid and infections of the urethra or cervix. 1 gram to 2 grams taken as a single oral dose, depending on the specific diagnosis. For children, doses for children are based on body weight and the type of infection being treated. Ear infections, 30 milligrams per kilogram as a single dose, or 10 milligrams per kilogram daily for 3 days, or 10 milligrams per kilogram on day 1, followed by 5 milligrams per kilogram daily for the next 4 days. Sinus infections, 10 milligrams per kilogram once daily for 3 days. Pneumonia, 10 milligrams per kilogram on day 1, followed by 5 milligrams per kilogram once daily for 4 more days. Strep throat and tonsillitis, 12 milligrams per kilogram once daily for 5 days. Azithromycin, Zithromax side effects. What you should know. What are the side effects of azithromycin, Zithromax? While azithromycin, Zithromax, is generally well tolerated, it can cause side effects in some individuals. Many of these effects are mild and tend to subside as your body adjusts to the medication. However, it's important to monitor any symptoms and inform your healthcare provider if they persist or worsen over time. Common side effects. These are the most frequently reported side effects and are often mild in nature. In adults, diarrhea, 4% to 5%, nausea, 3%, abdominal pain or stomach cramps, 2% to 3%. In children, diarrhea, 2% to 6%, vomiting, 1% to 6%, stomach pain, 1% to 3%. Other reported side effects. While less common, these additional side effects may occur. Flatulence, gas, dizziness, headache, skin rash, additional episodes of nausea. Serious side effects. Seek immediate medical attention. Though rare, azithromycin may cause serious and potentially life-threatening side effects. Contact your healthcare provider or seek emergency care if you experience any of the following. 1. Severe allergic reactions, anaphylaxis or drug reaction. Hives or widespread rash. Blistering skin. Swelling of the lips, face, or tongue. Fever. Difficulty breathing or swallowing. 2. Liver toxicity or liver failure. Yellowing of the skin or eyes, jaundice. Abdominal swelling or tenderness. Confusion or disorientation. Dark or tea-colored urine. 3. Irregular heart rhythm, QT prolongation. Heart palpitations or pounding heartbeat. Chest pain. Fainting or lightheadedness. Shortness of breath. 4. Clostridium difficile-associated diarrhea, C. Diff infection. Persistent or severe diarrhea, up to 15 times a day. Foul-smelling stool. Fever. Rapid heart rate. Nausea or abdominal discomfort. Pharmacist tips for azithromycin, Zithromax. To ensure the safe and effective use of azithromycin, Zithromax, here are key pharmacist-recommended tips for both tablets and oral suspension. General tips for all forms. Take with or without food. Azithromycin can be taken on an empty stomach, but if it causes stomach discomfort, taking it with food may help reduce irritation. Complete the full course. Even if symptoms improve early, it's important to take the entire prescribed course. Stopping prematurely may allow the infection to return and become more difficult to treat. Watch for severe diarrhea. If you develop a fever along with watery or bloody diarrhea during treatment, or even weeks after stopping, seek immediate medical attention. This may be a sign of a serious intestinal condition called C. difficile-associated diarrhea. Discuss probiotics with your provider. If you experience mild diarrhea, your healthcare provider, HCP, may suggest taking a probiotic to help manage the side effect. However, be sure to separate probiotics and azithromycin doses by at least 2 hours to prevent the antibiotic from killing the beneficial bacteria. Be aware of rare side effects. Though uncommon, azithromycin has been associated with ringing in the ears or temporary hearing loss. Report these symptoms to your provider immediately for further evaluation. If treating a sexually transmitted infection, STI, it's important that your sexual partners are also treated to prevent reinfection. In many states, expedited partner therapy allows your provider to write a prescription for your partners without requiring a separate appointment. Ask if this option is available in your area. Tip specific to azithromycin oral suspension. Know your strength. The liquid form comes in 100 milligrams per 5 milliliters and 200 milligrams per 5 milliliters formulations. Double-check the strength with your pharmacist to ensure accurate dosing. Shake well before each use. Always shake the bottle thoroughly before measuring your dose to ensure even distribution of the medication. Use the correct measuring tool. Use a medication syringe or dosing cup from the pharmacy. Do not use household spoons, as they are inaccurate and may lead to under- or overdosing. Storage guidelines. Suspension can be stored at room temperature or in the refrigerator, but not below 41 degrees Fahrenheit 5 degrees Celsius. Refrigeration may help improve taste, especially for children. Discard any unused suspension after 10 days, even if there is medication left in the bottle. Stay informed with HeInfo for more reliable, easy-to-understand medication guides and health tips backed by science and reviewed by medical professionals. Subscribe to HeInfo. Leave a comment if you've taken azithromycin before, and share your experience to help others make informed decisions. Like, share, and follow HeInfo, your go-to resource for trusted health education.